Right now at 4:30, President Biden continuing to work virtually after testing positive yet again for COVID. He's under what's called a second isolation period, but doctors say this isn't a second infection. It's actually something called rebound positivity. Yes. WCNC Charlotte's Vanessa Rufus, you've been looking into what causes this, and it could happen to anyone, but in particular if you're taking a certain antiviral drug for COVID.
Yeah, that's right. So, Carolyn, you'll remember that the drug that President Biden was prescribed when he first tested positive is called Paxlovid. This is the treatment that gets prescribed to people who are at risk for serious COVID complications. And so he started taking this after his first positive test nearly 2 weeks ago. He left isolation several days after that, getting some negative tests last week. And then over the weekend, he started testing positive again. Here's what's happening.
It's called rebound positivity, and it's a possibility for those taking Paxlovid, a COVID antiviral pill that helps reduce the risks of severe complications.
The antiviral Paxlovid works to repress or suppress viral replication in the body.
But Mecklenburg Public Health Director Dr. Raynard Washington says sometimes the pill works so well, the virus bounces back.
That viral replication, when the person's no longer taking Paxlovid, can start to pick back up. And so then you might have enough viral particles in the body to be detected on a test.
FDA and CDC fact sheets on the treatment say this rebound can also emerge as resurfacing symptoms.
In most cases, the person won't become infectious again, and that level of detection where they can actually detect the virus, meaning the test is positive, should go away in several days.
In either case, rebound positivity calls for isolating again for at least 5 days. In rare cases, a person might keep testing positive after day 10, but the CDC says at that point, it's unlikely the person is shedding any infectious virus.
And so the good news here, rebound positivity doesn't appear to foreshadow any severe outcomes, meaning if this does happen to you, it's not necessarily a sign that the pill didn't work for you. Now, how rare is it? Well, a team of researchers at the Mayo Clinic recently looked into folks taking Paxlovid. They found that it impacted less than 1% of folks that they were studying, Carolyn.
Interesting. He just happens to fall in that 1%.
Yeah.
Vanessa, thanks.